I woke up during my own surgery, and my surgeon didn't know. I'd gone in for a routine knee reconstruction after tearing my ACL on a hiking trip. Dr. Whitfield had a reputation as the best orthopedic surgeon in the county, and everyone at the clinic loved him. He was warm, funny, the kind of doctor who remembered your dog's name. I trusted him completely. So when the anesthesiologist put me under, I wasn't scared at all, except I never actually went under. Not fully. I felt the drugs hit, that heavy sinking sensation like my body was sliding into wet sand, but my mind stayed lit, awake, aware. I could hear the machines beeping, the low murmur of the OR staff, the clink of instruments on a metal tray. I tried to scream. Nothing came out. I tried to twitch a finger. Nothing moved. I was a passenger locked inside a body that no longer answered to me, and the panic that came with that realization was unlike anything I'd ever felt. For the first 20 minutes, everything seemed normal. I heard Dr. Whitfield talking through the procedure with his resident, calm and methodical. Then, near the end, he told the resident to step out and prep the next patient's chart. The resident left. The nurse followed a minute later to restock supplies, and the second the door clicked shut, something in the room changed. I heard him set down his instruments, slowly, deliberately, then footsteps coming toward my head instead of my knee. He leaned over me and I felt his breath near my ear. "You always did like being the center of attention, didn't you, Nicole? My name isn't Nicole." He kept talking, low and bitter, like he was continuing a conversation that had started years before I ever met him. He said Nicole left him for his old business partner. He said she took the house, the savings, humiliated him in front of everyone they knew. He said she used to lie there just like this, acting so innocent, while he did everything for her and got nothing back. Then he touched my face, gently at first, almost tender, and then his hand tightened around my jaw. He turned my head side to side like he was inspecting something he owned. "I could do anything I wanted right now," he whispered, "and you'd never even know. I have never been more afraid in my life." I couldn't feel pain from the anesthesia, but I felt every ounce of what he was doing, the violation of it, the complete helplessness. I understood in that moment that if he realized I was conscious, he might not let me leave that operating room the same person I walked in as. So I did nothing. I forced my breathing to stay slow and even. I let my eyes stay half-lidded and empty. Somewhere behind the terror, a cold, clear thought took over. Survive this. Remember everything. Tell someone. He pressed something against my thigh, hard enough that I think it would have bruised if I'd been able to feel it properly, right in a spot far from my actual surgical site. I heard him mutter something about leaving a mark before the door handle rattled, and he jerked upright, instantly composed, instantly the surgeon again. The resident walked back in like nothing had happened. The rest of the surgery passed in a blur of controlled panic. When I finally woke up for real in recovery, I played groggy and confused, mumbling about my knee, thanking the nurses, smiling weakly at Dr. Whitfield when he checked on me. Inside, I was screaming. I didn't say anything until I was home, 3 days later, when the bruise on my thigh bloomed dark purple, in a shape no post-op procedure could explain. I went to a different hospital, explained everything to a nurse who didn't flinch, who believed me immediately and called it in. The investigation moved fast once they pulled his surgical footage, standard OR camera protocol he'd apparently forgotten about or assumed no one would review. It showed everything. His voice, his hands, the bruise being made. They found 4 other cases flagged in the following weeks. Women who'd had unexplained marks after surgeries he performed alone, all filed away as complications, never questioned. Dr. Whitfield lost his license before his hearing even started. Last I heard, the criminal case is still moving through the courts, and I've been asked to testify. I still have nightmares about not being able to move, but I'm done staying quiet, and I'm done being invisible in my own story.